Carlson. I'm Dr. Joy, the anesthesiologist. How are you doing today?
I'm fine, I guess. I'm a little nervous.
Oh, it's understandable to be a little bit nervous before surgery. Do you have any questions before we start today?
You said you were an anesthesiologist, and I've heard the term anesthetist. What's the difference?
An anesthetist is usually a certified registered nurse with specialization in anesthesiology, and an anesthesiologist is someone who has a medical degree with a specialization in anesthesiology.
Dr. Joy, I know the orthopedic surgeon operates on the joints and bones, but what role does the anesthesiologist play in the surgery process?
Anesthesiologists have a very important role during the surgical procedure. They assess, consult, and prepare patients for anesthesia and surgery. They relieve and prevent pain during the surgical operation and afterwards, and they monitor and maintain the patient's physiology in the perioperative period.
Well, I can see the anesthesiologist plays a key role, but can you explain what you just said in layman's terms?
We provide the methods for prevention and treatment of pain. We help patients undergo the surgical procedure without pain and with stable vital physiological functions and comfort by inducing sleep, which is known as general anesthesia, or sedation with a local anesthesia, regional anesthesia, or peripheral nerve blocks. We facilitate the surgical procedure. For example, we make the patient's muscles completely relaxed so the surgeon can work easily during the operation. We wake up the patient promptly after the surgery is done, and the pain related to the operation is minimized and controlled to the level the patient can tolerate well without much stress. You do not need to worry, Ms. Carlson. I will take care of you when you're asleep, and I will wake you up without much pain when the procedure's done.
I feel a little better now. It's amazing how much anesthesiologists have to know and how quickly they have to act if the patient's in a life-threatening condition. You're kind of like an airline pilot, you know, how and when to take off and how to land smoothly and safely.
As anesthesiologists, our primary concern is patient safety. Within the domain of safety, it is important that we identify patients' comorbidities, including cognitive function, so that we can design the optimal anesthetic and ensure that when complications occur, we know what their potential etiology is and how to treat them. We also must ensure that we set expectations of what happens both during and after surgery, in many ways to relieve anxiety, as well as to ensure they have an optimal perioperative course. With respect to the latter, it really is important that we set what will happen after surgery so that they're not anxious about having some discomfort or some nausea and vomiting that we can treat. With regard to anxiety itself, which can provoke a stress response, which can cause problems, we need to assure the patient understands that we will be there during the anesthetic, that we will be watching their heart rate, ensuring that their breathing is adequate, and that they will be safe.
麻醉是一门高风险的行业，所以要做到安全、有效、舒适，并且呢不给患者造成伤害。那么在这个过程中，除了努力提升我们的临床业务能力之外，更多的是提高我们对患者的沟通协调能力和用心的呵护的这样一个氛围。从这个角度来说，我们需要的是人文的精神在临床戏剧中的体现。我们不但要呵护好我们的患者，同时也要呵护好我们麻醉这样一个宝贵的群体，我们的自身。